This week's deep dive tutoring session, we're going to take a look at the anatomy of the head as seen through a midline view. So you're going to see a head that's been cut right down the center. So as you're looking at this, you're going to probably note that there is a ton to look at. And that's one of the advantages of making a cut like this, is it gives you a snapshot of the body in one plane, and you can see a lot of different structures here. So let's just go around and give you the tour. So first, you're probably going to notice this massive thing right here. This is going to be the tongue. Now, it's probably a lot bigger than you thought it was, or at least that's typically what we hear. But it needs to be this massive because it's moving all the time. You need to have a lot of muscle tissue that it can just propel and move food from side to side during chewing or mastication, or even push it down to the back of the throat. And that's exactly what this is right here. Except in anatomy, we would call this the pharynx. Now, the pharynx is divided into three different sections. You have the nasopharynx, the oropharynx, and then the laryngopharynx, which is going to come into contact with this structure here called the epiglottis. Now, this little flap actually helps to protect the airway when you're drinking or eating food, because we want that food to go down this posterior tube here, which we call the esophagus, and not go into the airway, which is going to be right in front of it. So this area is called the larynx, or your voice box. And you can even see, if you look closely, hopefully you'll be able to see this structure here. This is part of a vocal cord and the vocal epithelium. And then that's going to transition into the trachea, or your windpipe. Now, both of these tubes are going to be located just in front of the cervical spine. So the cervical spine, there's going to be 7 vertebrae in here, and you can see this thick portion of bone. We call that the vertebral body. And then in between, you're going to see these intervertebral discs. So if you've ever heard of someone saying they slipped a disc or herniated a disc or something along those lines, they're talking about these cartilaginous discs right here. Now, right behind the cervical spine, you're going to see this long white structure. This is the beginning part of the spinal cord. Now, the spinal cord is going to be encased and protected in the vertebrae, in these bony structures, and so there's a pathway that goes all the way down your back, which we call the vertebral canal. And this is just going to be, it's going to reside inside of it. And then spinal nerves are going to branch off of it, and that's going to go to many different places in the body. But the spinal cord, if we come up, you're going to see that it then blends into the brainstem. Now, we talked about the brainstem in last week's deep dive, so you can go ahead and check that out if you want to see more about it. But it's also entering into the cranium through a hole here. This gap is called the foramen magnum. And this is just a large hole at the base of the occipital bone, and that's this massive bone back here. And you can see just how thick it is. It's a very thick bone. And then, so again, you can see, we talked about a lot of these structures last week, but then there's this thick band of white matter right here that I want to talk about. This is called the corpus callosum. Now, the corpus callosum is going to connect the left and right cerebral hemispheres. So if you look behind this right here, you're going to see the brain. That is the left hemisphere. And what's separating it from what would be the right hemisphere here is what's known as the falx cerebri. This is just a sickle-shaped, kind of like the Grim Reaper's sickle. This is a sickle-shaped piece of connective tissue, dense connective tissue, which we call dura, that is just going to separate those hemispheres. And there would be another one covering the cerebellum, which is down here, and then there'd even be another one going in the horizontal plane, which you can't see from this view. You can also see the nasal septum, which is going to divide the left and right aspects of the nasal cavity. So if you've ever heard of someone having a deviated septum, you're talking about this. In fact, I can see if we can do this. I can stick the probe, see if we can get it. Yeah, and you can see the probe coming out into the nasopharynx. And then, coming back towards that oral cavity where we began, there is the hard palate, which is actually a combination of the maxilla bone as well as the palatine bones. And then we get into the soft palate, which is going to help block off that nasal cavity during swallowing. So I hope you enjoyed this deep dive, and I look forward to seeing you next week.